we will talk about herniated disc and why it's important at all, because any of us has 40% lifetime risk of herniated disc. It's huge risk and is quite common condition. Now let's say what is the most common symptoms and how we can detect herniated disc. It usually starts as intermittent back pain, but this pain intensity increases over time. Pain radiates to leg and causing leg pain, also leg numbness, weakness and tingling sensation. This combination of symptoms like leg pain, leg numbness, weakness and tingling is called sciatica, and it's highly suggestive of herniated disc. Now let's explain what is the mechanism. We have vertebrae, and between vertebrae we have vertebral disc, intervertebral discs, and these discs play a role as a shock absorber. And over time, because of aging or because of heavy lifting, because of twisting, bending and different movement, over time this disc can weaken. This disc has fibrous capsule. You can see here this capsule here, and this capsule weakens over time and it's bulging. Here is bulging already. This is bulged disc, and this bulging over time can rupture, and inside these discs there is gel-like material, and this material is released. This material compress nerves and cause symptoms and cause inflammation. That's why we have pain. And this bulging, if less than 3 millimeters, symptoms may not occur at all. So many of us already have this protrusion. This bulging is called protrusion, but no symptoms, asymptomatic. If this bulging is more than 5 millimeters, symptoms usually occur. If it's more than 7 millimeters, it's already serious condition, and sometimes surgery is needed because conservative treatment is not enough. We have several types of this bulging. Protrusion is just bulging of this part of vertebral disc. It's protrusion. If this fibrous capsule and this bulging is already ruptured and gel-like consistency is already released but still connected to the disc, it is called extrusion. And if we have separated gel-like material and disc are separated, it is called sequestration. So we can say that protrusion is milder form, extrusion is more severe form, and sequestration is already severe form. When we have protrusion, conservative treatment is commonly enough. If we have extrusion, conservative treatment plus steroid injection also effective in many cases, and we have sequestration, there is high risk of surgery, because many cases conservative treatment is not enough. How we diagnose it? We diagnose based on clinical picture and MRI. MRI shows well this protrusion, so we can see protruded part of disc. And first line treatment is non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. They have high effectiveness, around 70%, and sometimes steroid injection is needed, especially if there is extrusion and if these symptoms are not managed and cannot managed by conservative treatment like anti-inflammatory steroids and steroid injections, then surgery is needed. It is called lumbar microdiscectomy, and surgery is highly effective. Around 90% of cases it's effective, so it's very important and high effectiveness of heart surgery. But if we say that if there is guaranteed cure, there is no guaranteed cure, because around 10% of cases, symptoms still reoccur after several months or after period of time. It can return. So cure is not guaranteed, but surgery is highly effective, we can say this. And what is risk factors? Risk factors is lifting weights over 23 kilogram. Also BMI, when there is obesity, is important risk factor, and age after 35 to 55 is common condition. And what is prevention and how important is prevention? Prevention is very important because exercising regularly and strengthen the core and back muscles, it can prevent this herniation at all. That's why it's important, because we have high risk of this disc herniation, but we can avoid with simple exercises like planks, for example, or hamstring stretches, or lumbar exercises, lumbar extension exercises. So we can prevent. That's why it's important. And prognosis usually is good. In 50% of cases, generally conservative treatment is effective, and this pain will go away, and time which is needed for symptoms to resolve is around 6 weeks. After 6 weeks, people usually feel much better. Sometimes, as we said, surgery is not effective also, and we need sometimes another surgery. Sometimes we need much more intense care. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.